In this video we are going to see about tibia for exam purpose. So tibia is also known as shin bone. Shin means anterior aspect of the leg. This bone is present in the anteromedial aspect of the leg, so it got the name shin bone. So it is one of the long bone. As usual, all the long bone have two ends and one shaft. It also have the three parts. First we have to know about the side. So I am holding a right sided bone. So right sided bone, how I am saying, first we have to see the lower end. Lower end will have one projection. This projection is known as malleolus, and it will have one small depression. This depression is known as notch. If you appreciate that depression, it will go upward like a triangular one. This depression is known as fibular notch, to this which the head of the fibula will articulate, and this is the medial malleolus. So the malleolus should face medial and the notch should face lateral. And if you come upward, you will see a prominence. This prominence is known as tibial tuberosity. It should faces anterior. Okay, if this 3 point you appreciate, then you can identify the side very easily. Now we will see the upper end. Upper end of the tibia, if you see, it will appear somewhat like this, and compared to these two projection is known as condyle, lateral and medial. If you notice clearly, the medial one will be bigger than lateral one, and in between them there will be a small elevation. This elevation is known as intercondylar area. So to this area, the lower end of the femur will articulate like this. Femur have two condyles. These condyles will sit over the tibial condyles, and in between the condyle of the femur there will be a depression. This depression will be occupied by this intercondylar area. This intercondylar area is very much important clinically. This intercondylar area have 5 important ligament attachment, and this condylar area of the tibia also have some important thing. The important thing in this condylar area is known as meniscus. Meniscus is a fibrocartilaginous ligament which separate tibial condyle and femoral condyle from friction. So the medial meniscus somewhat like a semilunar one, lateral one somewhat like a semicircular one. Both of them attached to this condylar area. So this intercondylar area have 5 ligaments. First, anteriorly we will have anterior horn of medial meniscus, followed by anterior cruciate ligament, then posterior horn of medial meniscus, then posterior horn of lateral meniscus, then posterior cruciate ligament. Except anterior horn of lateral meniscus, 5 ligaments are related to this intercondylar area. Then if you come down, this is lateral condyle and this is medial condyle. In the lateral condyle, in the side, you will appreciate one small tubercle. If you palpate the bone, you can appreciate one small tubercle. That tubercle is known as Grady tubercle. G-R-E-Y-D, Grady's tubercle. This Grady's tubercle give attachment to one important structure called iliotibial tract. So that you have to remember. They will ask in VIVA. Then in the posterior aspect, in the medial epicondyle, medial condyle, in the posterior aspect, 3 muscles will insert: gracilis, sartorius and semimembranous. These 3 muscles are collectively called as guy rope muscle. These 3 muscles will insert behind the medial condyle. These things you have to remember. Then if you come down in the shaft, in the posterior aspect, you will appreciate one line is running toward medial aspect. One line will run upward to downward like this. This line is known as transverse line. This line is known as soleal line. Above this line and in this line, one muscle called soleus will originate. Soleus is known as peripheral heart because soleus have many deep veins. So to pull the veins in the lower limb will have valves because they have to pump the blood against the gravity. So this soleus muscle have many perforated veins, many deep veins. So this muscle while standing, while resting also, this muscle will actively undergo minute contraction and may pump the blood toward heart. So this muscle is known as peripheral heart. So soleus muscle will attach here. Then if you come down, the lower end will have medial malleolus. Malleolus means hammer in Greek word. So it is looks like head of the hammer, so they name it as malleolus. And lower end of this bone, if you appreciate, it will have 5 surface: inferior surface, this is medial surface, lateral surface, anterior surface, and posterior surface. This lower end, even if you study radius also have this 5 surface, tibia also have 5 surface in lower end. Inferior aspect of this surface will articulate with one bone called talus. Talus will join with tibia and fibula to form angle joint. Talus have one part called supratrochlear part. That part will articulate here. So this area is a facet for talus. So this is the important features about lower end. Then if you come to shaft will have 3 borders and 3 surface. The anterior border you can easily appreciate from this tibial eminence. If you come down, you can appreciate the anterior border. Then medial and lateral border. In this bone, the lateral border will be a sharpest one. You can place your finger and feel the sharpest border will be lateral border, because this lateral border is also known as intraosseous border. It will attach to the intraosseous membrane which connect the fibula and tibia. So intraosseous membrane is an example of syndesmosis variety of fibrous joint. Then if you come to the anterior aspect, the tibial tuberosity. This tibial tuberosity give attachment to one thing called ligamentum patellae. Ligamentum patellae is a continuation of insertion of quadriceps femoris. So this above this area, patella bone will present and the ligamentum patellae will come and attach to this tibial tuberosity. There will be a small space will be present between this both area. That space is known as infrapatellar bursa. Then in the shaft, below this soleal line, we have multiple muscle attachment: flexor digitorum profundus, flexor hallucis longus, tibialis anterior, like many muscles are originating. But you have to remember mainly the gyrope muscle and the greater tubercle and this medial malleolus, lateral malleolus things. Okay, thank you.